Hi, now we will talk about hand sensation at the fingertips. A well-known test for this is a two-point discrimination, in which typically a discriminator is used to test for this, but in this case we will use a paperclip. You want to make sure that the paperclip is approximately 5 to 8 millimeters apart. The client must discriminate between 1 or 2 points during the sensation assessment. The examiner can also conduct this test as a dynamic, in which you will rub the 2 points or 1 on the distal phalanx like this. This is the dynamic testing. Or the static testing, in which you can use the same paperclip again and just keep it steady. You want to make sure that when you get to the ring finger, you test both radial side and the ulnar side. You can also continue this by testing the reflexes of the biceps right here, the brachioradialis, and also the triceps back here on the olecranon. The ulnar nerve runs around the medial epicondyle, this area right here, through the cubital tunnel in here, and it splits between the flexor carpi ulnaris, this area, before going to the digits. Ulnar nerve entrapment can occur halfway of the medial humerus, approximately right here, or 6 centimeters distally on the forearm, right about here. When a person has cubital tunnel syndrome, they will have difficulties with elbow flexion, and they will also have tingling and numbing with tenelles over the nerve, or tapping. They may also have clawing of the little and ring finger, and hyperextension at the MP joint with flexion at the IP joints. Next, we will test the thumb and the index pinch strength. By doing this, you want to get either a card or paper, insert it in between the thumb and the second digit, like so, and just pull. If there is a problem with this, the patient will have flexed thumb and they will not be able to hold the card. This is called Foreman's test. For a positive Wartenberg sign, the patient cannot adduct the little finger to the other digits. They will have difficulty, and it will demonstrate as abduction. For median nerve compression, thenar atrophy can occur and the adductor pollicis brevis is weak, and the client will have difficulty with opposition. In this case, it is normal. But if there were any median nerve compression, they will not be able to do thumb opposition, and it will indicate like this. The grind test is used for carpal metacarpal arthritis of the thumb. The thumb is grinded on the trapezium, and if the patient has pain or swelling in this area, the test is positive. Now we will look at the FDS and the FDP to see if the patient can actively flex at the DIP joints. You want to do this for each digit. Keep in mind that you do want to isolate the FDS because it does have four muscle bellies. For the FDP, you also want to grab the finger like this and see if they can flex at the DIP joint. For this test, you do not want to hold on to the other fingers because you will be entrapping the FDP, since it does have only one muscle belly. Now we're going to talk about radial nerve injuries. When the radial nerve is severed, it will cause wrist drop, like this. Because, as we all know, the radial nerve innervates all the wrist and finger extensors. To test for radial nerve palsy, you want to see if the client is able to bring the wrist up. We'll demonstrate again. Bring it up. Okay. And you also want to make sure that they can bring the thumb up and over onto the other fingers. In addition, to test the extensor digitorum communis, you want to make sure that the patient can flex the IPs while keeping the MCP in extension, like this. And just to finish off and complete our video, we're going to talk about common deformities, which include the boutonniere finger, the swan neck, and the mallet finger. In this case, Christina does have a swan neck, where the PIP joint is hyperextended and the DIP joint is flexed. We will also demonstrate a mallet finger, which is characterized by flexion of the DIP joint, like this. All of the above deformities can be caused by trauma and/or can be due to degenerative diseases such as arthritis. And thank you for watching this video. Hope it was very helpful and have a great Memorial Day weekend.